Hi everyone. Today we'll be discussing the cardiovascular condition patent ductus arteriosus, which is an abnormality in blood flow occurring in children. To discuss this, we'll be starting with normal adult circulation that was discussed in cardiovascular physiology, lecture 1, slide 8.
So for normal postnatal circulation, the flow of blood can be split into two stages, pulmonary circulation and systemic circulation. In pulmonary circulation, deoxygenated blood from all around the body flows through the superior and inferior vena cava, enters the right atrium, and is pumped into the right ventricle. This blood is then pumped through the pulmonary arteries into the lungs, where it gets oxygenated. After oxygenation, blood is transported via the pulmonary vein to the left atrium. In systemic circulation, blood from the left atrium is then pumped into the left ventricle, from where it is pumped into the aorta and can now travel the rest of the body through arteries.
While this is the regular circulation postnatally, this is not the case for the fetus. In fetal circulation, deoxygenated blood from the fetal body enters the right atrium and goes into the right ventricle and to the pulmonary artery. From the pulmonary artery, a very small amount goes to the lungs, but most of the blood shunts via the ductus arteriosus to the descending aorta. The ductus arteriosus is a blood vessel that connects the pulmonary artery and to the descending aorta. This blood travels through the umbilical arteries to the placenta, which serves to do the work of breathing.
In the placenta, carbon dioxide and waste products are released into the mother's circulatory system, and oxygen and nutrients from the mother's blood are released into the fetus's blood. This blood is now considered oxygenated. So this oxygenated blood is then taken through the umbilical veins to the right atrium. The blood will now get shunted through the foramen ovale into the left atrium. Blood then passes into the left ventricle and travels to the ascending aorta, which sends this oxygenated blood to the rest of the organs.
In the fetus, blood should not enter the lungs because their lungs are not strong enough yet. But after birth, the umbilical cord is clamped, and with the first breaths of air, the lung expands and the ductus arteriosus and foramen ovale close. Now the heart functions like what was discussed in the previous slide.
So although the ductus arteriosus is supposed to close postnatally, patent ductus arteriosus is a condition that occurs when this fails to happen. As a result, oxygenated blood from the aorta can now mix with deoxygenated blood in the pulmonary artery, resulting in too much blood flow into the lungs. This puts a strain on the heart and increases blood pressure in the pulmonary arteries.
While the causes of patent ductus arteriosus is unknown, it is thought that genetics might be playing a role. Patent ductus arteriosus affects twice as many girls as boys, and since premature newborns are more likely to have underdeveloped lungs and heart, they're at an increased risk of being hypoxic and having patent ductus arteriosus. It's also common among babies with genetic disorders like Down syndrome and babies whose mothers had rubella during pregnancy.
So some of the symptoms of patent ductus arteriosus can include tachycardia, which is because the heart would need to work harder to oxygenate the body. Another symptom is continuous machine-like heart murmur, which is usually from the aorta to the pulmonary artery because of the higher flow during systole and lower flow during diastole. Another symptom is cardiomegaly, which just means enlarged heart, which would be reflecting the ventricular dilation and volume overload. And then we also have widened pulse pressure, increased systolic pressure and cardiac output, and differential cyanosis, which is just cyanosis of the lower extremities.
For diagnosis, usually a chest X-ray is performed, followed by an electrocardiogram or ECG to measure the heart's electric activity and show if it's enlarged. An echocardiogram, which just means an ultrasound of the heart, can also be done to see how big the opening is and how well the heart is handling it.
So now for some of the treatment options for patent ductus arteriosus. So if the patent ductus arteriosus is small, it won't make the heart and lungs work harder. So in this case, surgery and other treatments may not be needed because the small patent ductus arteriosus can just close on their own within the first few months of life. But in most cases, children can have it closed by inserting a coil or some sort of a device through the catheter into the blood vessels in the leg, sorry, to reach the heart and act like a plug to close off the ductus arteriosus. Or in more severe cases where catheter insertion may not be possible, a surgical alternative can be performed. This would basically involve making an incision in the left side of the heart and then closing the duct using suture, or by permanently placing a small metal clip along the ductus to squeeze it shut.
Thank you for listening to us.